I pray that no one ever gets infected with the deadly hantavirus, but awareness can save lives. Knowing the symptoms, causes, and prevention methods is extremely important because early understanding can protect you and your loved ones from serious danger. Stay informed, stay careful, and spread awareness. Good evening, and stop what you are doing right now, because what I am about to share with you could be the most important health warning you hear all year. There is a virus spreading across multiple regions of the world right now, and the mainstream media is barely covering it. It has no widely available vaccine. It has no specific antiviral cure. And if you are over the age of 60, your immune system may be far less equipped to fight it than you think. The virus I am talking about is called hantavirus, and in some outbreaks, it has killed more than 1 in 3 people it infects. 1 in 3. I want you to let that number sit with you for a moment. I am Dr. William Lee, and I've spent decades studying how infectious diseases interact with the aging immune system. I have seen what this virus can do firsthand, and I am here today because you deserve to know the full truth about what hantavirus is, how it spreads, what it does to your body, and most critically, what you need to do this week to protect yourself. A 2023 study published in the journal Emerging Infectious Diseases found that adults over the age of 60 face a significantly elevated risk of severe outcomes from hantavirus infection compared to younger populations, largely due to age-related decline in pulmonary immune function and cardiovascular reserve. That study should have been front-page news. It was not. And here is the thing they are not telling you on the evening news. You do not have to be hiking in a remote forest to be exposed to this virus. You could be cleaning out your garage. You could be opening a shed you have not touched since last fall. You could be sweeping your basement. The exposure risk is closer to home than most people realize, and the people most vulnerable are sitting right here, watching videos like this one, trying to take care of their health. So stay with me, because in the next few minutes I am going to walk you through everything you need to know. And I am going to tell you something early that is going to completely change the way you think about how this virus spreads. But before we dive in, I want to ask you something personal. I want to know how old you are and whether you or someone you love has ever lived in a rural area or spent time in older buildings, basements, or storage spaces. Drop your age and your answer in the comments below. I read every single comment on this channel, every one. And your answers help me make sure I am giving you the most relevant, most targeted health information possible. This community is everything to me, and your voice matters here. Now let us start from the very beginning, because if you do not understand what hantavirus actually is, everything else I tell you will not make as much sense. Hantavirus is not new. It belongs to a family of viruses called Hantaviridae, and it has been circulating in rodent populations for thousands of years. What is new is where it is showing up, how frequently it is being detected, and how unprepared our public health messaging has been in warning older adults specifically. The virus exists in at least 21 known strains worldwide. Different strains predominate in different regions, and the 2 major disease syndromes they cause are hantavirus pulmonary syndrome, which is the more deadly form seen primarily in the Americas, and hemorrhagic fever with renal syndrome, which is more common in Asia and Europe. Both are serious. Both can kill, and both are carried primarily by rodents, most commonly by mice and rats, though different species carry different strains. The sin nombre virus, which is the strain responsible for most hantavirus pulmonary syndrome cases in North America, is primarily carried by the deer mouse, a small, big-eared rodent that is found in virtually every region of the United States, across Canada, and throughout parts of Mexico. The deer mouse looks harmless. It is almost cute in a way, but it is one of the most dangerous animals you will ever encounter without knowing it, because it sheds the virus in its urine, its feces, and its saliva, often without showing any signs of illness itself. The mouse feels nothing. It goes about its life, and it leaves behind invisible contamination that, when disturbed, can end yours. Now here is the part that surprises most people. Here is the thing I told you I would reveal early, and I want you to pay very close attention because this is where so many people go wrong. Hantavirus is not spread person to person. You cannot catch it from another human being who is infected. You cannot get it from shaking hands, sharing a meal, or sitting in the same room as someone who is sick. Unlike influenza, unlike COVID, unlike the common cold, This virus does not pass between people in its most dangerous American strain. What this means is that every single case of hantavirus pulmonary syndrome is a direct result of that individual coming into contact with infected rodent material. Every case is, in theory, preventable, and yet people keep getting infected, keep getting hospitalized, keep dying, because they do not know what I am about to tell you. The primary route of transmission is inhalation. When rodent droppings, urine, or nesting materials are disturbed, when you sweep them, stir them up, or walk through an area where they have dried, the viral particles become aerosolized. They float in the air, invisible to the naked eye. You breathe them in. Within that breath, the virus enters your respiratory tract and begins its work. This is why cleaning dusty, rodent-affected spaces without proper protection is extraordinarily dangerous. A broom can be a weapon against you. A shop vacuum without a HEPA filter can spray contaminated particles directly into your lungs. This is how people die, not in dramatic ways, but quietly, doing ordinary household tasks, not knowing what they have just inhaled. There is also transmission through direct contact, touching rodent droppings or nesting materials, and then touching your mouth, nose, or eyes. There is a small possibility of transmission through rodent bites, though this is less common. And in some South American strains of hantavirus, specifically the Andes virus, there is limited evidence of person-to-person transmission, which is what makes that particular strain especially alarming to infectious disease researchers. Now I want to tell you about a real person. His name was Harold, and he was 67 years old, a retired school teacher from rural Montana. Harold was in good health for his age. He walked every morning, took his blood pressure medication faithfully, had just gotten a clean bill of health at his annual physical. In the late spring, he decided to clean out the old grain storage shed on his property, a shed that had not been opened since the previous autumn. He swept it out without a mask. He handled old burlap sacks that had rodent gnawings on them. He was inside that shed for maybe 45 minutes total. 6 days later, Harold developed what felt like the flu. Muscle aches, fatigue, a low fever, some nausea. His wife told him to rest. He rested. 2 days after that, Harold's breathing became labored. By the time his son drove him to the regional hospital, his oxygen saturation had dropped to 84%, a level that indicates the lungs are failing. Harold was placed in the intensive care unit. He survived, but only after 11 days in the hospital, several of which he spent on a ventilator. He has never fully recovered his previous lung capacity. He told me, when I spoke with him as part of an educational outreach program, that he would give anything to go back and simply put on a mask before entering that shed. 45 minutes. That is all it took. Harold's story is not unique. Let me share some of the documented cases that have shaped our understanding of how this disease moves through communities. In 1993, the Four Corners outbreak in the southwestern United States, spanning New Mexico, Arizona, Colorado, and Utah, became the event that put hantavirus pulmonary syndrome on the medical map in North America. During that outbreak, a cluster of previously healthy young adults died of what appeared to be a mysterious and rapid respiratory illness. Investigators from the Centers for Disease Control and Prevention eventually identified Sin Nombre virus as the culprit, with deer mice as the reservoir. Of the initial cases identified, the mortality rate exceeded 50%. Half of the people who were diagnosed died. That number should terrify you, and it should also motivate you, because knowing the mechanism of transmission is the first step in protection. In 2012, there was a significant outbreak linked to Yosemite National Park in California. Visitors who had stayed in specific tent cabin accommodations were exposed to infected deer mice that had nested in the insulation of the cabins. 10 people were confirmed infected, 3 died. The National Park Service conducted an enormous remediation effort, but the critical lesson was this: the exposure did not happen in the wilderness. It happened in a bed, in a cabin, in a place people considered safe and comfortable. If it can happen in Yosemite, it can happen in your vacation rental, in your hunting cabin, in the guest room of your home that sits unused for months at a time. More recently, cases have been reported with increasing frequency across the American Midwest and Pacific Northwest. In Chile and Argentina, Andes virus cases have continued to accumulate, with healthcare workers occasionally being infected by patients, a sobering reminder that some hantavirus strains are evolving in ways that should make us pay close attention. And in China, in March of 2020, a man died on a bus after testing positive for a hantavirus strain, triggering headlines around the world. Though experts were quick to clarify that Chinese hantavirus strains are not transmitted person to person in the same way COVID was. Still, the timing of that story, in the middle of a global pandemic, meant that many people registered the fear and then moved on without truly learning what they needed to know. So what actually happens inside your body when hantavirus gets in? This is where I need to ask you to stay with me, because understanding the biology is what makes the prevention strategies feel urgent and real rather than abstract. When aerosolized hantavirus particles are inhaled, they travel down the respiratory tract and bind to specific receptors on the cells that line the small blood vessels of your lungs. These receptors, called beta-3 integrins, are present throughout the body's vascular system, but they are especially dense in pulmonary capillaries, the tiny blood vessels that are responsible for the gas exchange that keeps you alive. The virus essentially hijacks these cells, replicating rapidly and triggering a massive immune response. In younger, healthy individuals, this immune response, while dangerous, can sometimes be managed. In adults over 60, this is where things become critically more dangerous. After the age of 60, your immune system undergoes what researchers call immunosenescence, a gradual aging and functional decline of immune cells. Your T cells, which are your body's frontline fighters against viral invaders, become less responsive. Your inflammatory cytokine responses become dysregulated, meaning your body is more likely to mount an excessive, disproportionate immune reaction, what doctors call a cytokine storm, rather than a controlled, targeted defense. A 2021 analysis from researchers at the University of New Mexico found that older adults infected with hantavirus showed cytokine profiles significantly more dysregulated than those of younger patients, contributing to more rapid progression to the critical phase of illness. That critical phase, called the cardiopulmonary phase of hantavirus pulmonary syndrome, typically arrives 3 to 7 days after initial symptoms. And the transition from feeling sick to being critically ill can happen in a matter of hours. Fluid begins to leak from damaged blood vessels into the lungs. The lungs fill. Breathing becomes impossibly labored. Blood pressure drops dangerously as the heart struggles to compensate. This is not a slow decline. This is a cliff. And when you step off it, you need an intensive care unit, vasopressors to support your blood pressure, and very possibly mechanical ventilation to breathe for you. There is no specific antiviral medication approved to treat hantavirus. Treatment is entirely supportive, meaning doctors manage your symptoms and keep your organs from failing while your immune system tries to win the battle. For too many patients, it does not win. Now I want you to think about another person. Her name is Marilyn. She is 72 years old, and she lives in a beautiful older farmhouse in rural Kansas. Marilyn is sharp, active, and takes extraordinary care of her health. She takes no medications, she gardens, she volunteers at her church, she has a vegetable garden she is enormously proud of. In October of last year, Marilyn began storing some of her garden equipment in her basement for the winter. The basement had some evidence of mice. She had seen droppings before, dismissed it as something manageable, put out a snap trap or two. She did not think much of it. She was in and out of that basement over the course of a week, moving things around, occasionally sweeping. 3 weeks later, Marilyn was in a hospital bed, her lungs so filled with fluid that she could not complete a sentence without stopping to gasp. Her daughter flew in from Seattle. Her pastor came to pray with her. Marilyn ultimately survived. She is one of the lucky ones, but she spent 3 weeks in the hospital, lost over 20 pounds, and has required supplemental oxygen at night ever since. She told me through tears that she felt stupid. I told her that she should feel nothing of the sort. She did not know. Nobody had told her. That is what I am here to change. So what do you actually need to do this week? Not next month. Not when the weather changes. This week. Because the single most important thing I can tell you is that prevention is not complicated, but it requires knowledge you act on. The first thing you need to do is assess your exposure risk honestly. Think about every space in your home and on your property that could be harboring rodents. Basements, garages, sheds, attics, crawl spaces, barns, vacation properties that have been closed up, storage units. Any space that is dark, rarely disturbed, and could have had rodent access, is a potential contamination site. Do not rely on whether you can see obvious droppings. Rodent contamination is not always visible, and the virus can remain infectious in dried materials for days under the right environmental conditions. The second thing you need to do, and this is non-negotiable, is to never dry sweep or vacuum a potentially contaminated area without proper respiratory protection. The minimum standard is an N95 respirator, properly fitted, not a surgical mask, not a cloth covering, not a bandana, an N95 respirator. If you are going into a potentially contaminated space, you also want gloves, and you want to wet down surfaces with a disinfectant solution. A mixture of bleach and water, 10 parts water to 1 part bleach, works well, before you disturb them. Wet cleaning is far safer than dry cleaning because it prevents particles from becoming airborne. Spray, wait 5 minutes, then wipe. Never sweep dry rodent material. The third thing you need to do is take rodent control in your home seriously as a health priority, not just a comfort issue. Seal any entry points, and understand that a mouse can squeeze through a gap the size of a dime. Check where pipes and wires enter your foundation. Check the seals around doors and windows. If you have an active rodent problem, address it promptly, and if possible, hire a professional pest control service that understands the protocols for rodent-related health risks. Snap traps are effective and are preferable to rodenticides, which can result in dead rodents in inaccessible areas, creating additional risk when the carcass eventually dries and becomes a different kind of contamination hazard. The fourth thing, and this is especially important for my viewers who are 60 and above, is to talk to your doctor specifically about your respiratory health baseline. Hantavirus pulmonary syndrome is most lethal in people who have underlying pulmonary conditions, cardiovascular disease, diabetes, or compromised immunity. After 70, the lungs begin losing approximately 1% of their functional capacity per year. After 75, research from the National Institute on Aging suggests that pulmonary reserve can be reduced by as much as 30 to 40% compared to peak adult function. This means that a virus that floods your lungs with fluid has far less room to maneuver before it becomes life-threatening. If you have any underlying lung condition, COPD, asthma, pulmonary fibrosis, your risk profile is significantly elevated. Your doctor needs to know you are taking this threat seriously, and you need to have a plan for seeking care quickly if you develop respiratory symptoms following any potential exposure. Before I continue, I want to take a moment to ask you something. If this information has been valuable to you so far, if you feel like this is exactly the kind of real, honest, potentially life-saving content that you want more of, please consider subscribing to this channel right now if you have not already, and hit the like button on this video. Every time you do that, the algorithm shows this video to more people. More older adults who may not know about this risk, more families who could protect their loved ones. You are not just helping yourself when you click that button, you are potentially saving someone else's life. I mean that sincerely. Now let me talk about something that does not get nearly enough attention: the psychological and social dimensions of hantavirus risk in older adults. Many of my patients and viewers fall into a category I think of as the generation of independent doers. These are people who grew up being told to handle things themselves, to not make a fuss, to push through discomfort. These are the people who are most likely to sweep out the shed alone, without telling anyone, without wearing protection, because it just seems like a simple task. And these are the people who are dying. I am not saying this to frighten you. I am saying it because I respect you, and I believe that you deserve accurate information delivered without condescension. The same strength and self-sufficiency that has served you throughout your life can become a vulnerability in specific situations like this one, where the danger is invisible, the symptoms mimic something ordinary, and the window between early illness and critical illness is frighteningly narrow. If you are going to do any cleaning or maintenance in a potentially rodent-affected space, please tell someone beforehand. Have a family member, a neighbor, a friend who knows where you are and what you are doing. If you develop any flu-like symptoms, fever, muscle aches, fatigue, headache, nausea, within 3 weeks of a potential exposure, do not wait to see if it passes. Go to an emergency room and explicitly tell the medical staff that you may have been exposed to rodent material. Those words, rodent material, will change the diagnostic pathway the doctors pursue. They will test for hantavirus. They will monitor your oxygen saturation closely. They will be watching for the cardiopulmonary phase. Early supportive care dramatically improves outcomes. Waiting until you cannot breathe can be fatal. I also want to address the global picture for a moment, because while much of my practical advice has been focused on North America, hantavirus is a worldwide concern. In South Korea and China, the Hantan and Seoul viruses, which cause hemorrhagic fever with renal syndrome rather than the pulmonary syndrome, infect tens of thousands of people per year. The Seoul virus is uniquely concerning because it is carried by the common brown rat, Rattus norvegicus, the rat that lives in cities around the world, on every continent except Antarctica. Seoul virus has been identified in pet rats in the United States, the United Kingdom, Europe, and Australia. It has been found in wild rat populations in urban areas. Hemorrhagic fever with renal syndrome attacks the kidneys rather than the lungs, causing hemorrhage, kidney failure, and in severe cases, death. In older adults, whose kidney function is already declining with age, a condition called age-related decline in glomerular filtration rate, the additional insult of a hantavirus attacking the kidneys can push those organs into failure rapidly. The Pumala virus, carried by the bank vole in northern Europe and Scandinavia, causes a milder form of the disease, but still results in thousands of hospitalizations annually. Dubrava virus in the Balkans, Sarama virus across Central Europe, Seoul virus globally. This is not a disease of one region or one country. It is a disease of wherever rodents and humans share space, which is to say, everywhere human beings live. And the spread is being accelerated by factors that are directly relevant to our current moment in history. Changing precipitation patterns are affecting rodent population cycles. When there are abundant acorn and seed crops, which happen in irregular cycles tied to weather patterns, deer mouse populations explode. More mice mean more viral load in the environment. Climate shifts are expanding the geographic range of carrier rodent species. Increased human encroachment into previously wild spaces is creating more contact opportunities. And an aging global population means a larger proportion of the people being exposed are exactly the ones least equipped to survive severe infection. I want you to know that I am not sharing any of this to create panic. Panic is not useful. Panic does not clean your basement safely. Panic does not seal the gap at the base of your garage door. What I want you to have, walking away from this video, is not fear. It is clarity. Clarity about what the risk is, where it comes from, who is most vulnerable, and exactly what steps to take. Let me give you a summary of the most important actions you can take, presented not as a checklist, but as a commitment to yourself and the people who love you. You have earned your life. You have worked for the independence and the health you have today. Every precaution I am asking you to take is in service of protecting that independence, protecting your ability to be present for your children, your grandchildren, your friends, your community. You did not survive everything you have survived to be brought down by a virus hiding in a pile of mouse droppings in a corner of your garage. Wear an N95 respirator anytime you enter a space that may have rodent activity. Wet clean rather than dry sweep. Seal your home against rodent entry. Control active infestations promptly and professionally. Know the early symptoms: fever, fatigue, muscle aches, headache, abdominal discomfort, and act on them immediately if you have had any possible exposure. Tell your doctor your concerns. Build awareness in your household so that someone is always watching out for your health alongside you. These are not dramatic interventions. They are straightforward, practical, achievable actions that you can begin taking today. I also want to mention that all scientific references cited in this video, the studies from emerging infectious diseases, the University of New Mexico analysis, the National Institute on Aging data on pulmonary reserve, are listed in the description below this video. I encourage you to share those with your doctor if you want to have a deeper conversation about your personal risk. It is never too late. That is something I say to my patients, and I mean every time. It is never too late to take protective action. It is never too late to learn something new that changes the trajectory of your health. The seniors I have seen thrive into their 80s and 90s are not the ones who were born with perfect genetics or who had perfect lives. They are the ones who stayed curious, stayed informed, stayed willing to adapt their behavior based on new information. You are that person. The fact that you are here, watching this, learning about a threat that most people your age have never even heard of, that is what health looks like. That is what intelligence looks like. That is what love for yourself and your family looks like. Please subscribe to this channel if you have not already, and share this video with everyone over 60 in your life. A sibling, a neighbor, a friend from church, a parent. You may be the reason they find out about this in time to protect themselves, and that matters more than I can express. Now I want to hear from you. Have you ever had a rodent problem in your home or on your property? Have you ever cleaned out a space without knowing the risks I described today? Drop your story in the comments. Tell me your age, tell me where you live, and tell me what you are going to do differently this week. I read every single comment, and I respond as often as I possibly can. This community is why I do this work. You are why I am here. Stay safe, stay informed, and I will see you in the next video.